In the United States, lung cancer is the leading cause of cancer-related deaths. Our next guest is Dr. Raymond Casciari, who has worked most of his career to promote the detection and treatment of this disease. Dr. Casciari is well known in Southern California for his work in both medicine and in the service to the community. For more than 30 years, he has practiced at St. Joseph's Hospital here in Orange. He is currently the Chief Medical Officer and the Director of the Lung Cancer Program. Ray, thanks for coming today.
Thanks for having me.
Welcome, Dr.
Thank you,
Casciari.
Heidi. Pleasure to be here.
Now, Ray, this is really a deadly disease, and tell us how it fits in the spectrum with other cancers in this country. You know.
Well, lung cancer, and it's not commonly known, is the most lethal form of cancer in this country. It kills more people in both men and women than breast cancer, colon cancer, and pancreatic cancer combined.
What is the symptomology of lung cancer? What should people be looking for?
Well, it's cough lasting more than 3 weeks, chest pain, shortness of breath, and certainly coughing up blood. Coughing up blood is never normal.
And if someone goes to get a CT scan of their lungs, what would be abnormalities that might show up with a scan?
Well, CT has been a wonderful advance, and we've come a long way in lung cancer, and a lot of it's due to CT. If you have a CT scan and you see a nodule or you see a mass on the CT that's unexplained, that needs to be investigated. And we need to either do a procedure to investigate it or at the very least see a specialist who knows about this disease.
Now, years ago, we did lung cancer screening with chest x-rays. Is that not the thing to do anymore?
That is absolutely not the thing to do. A chest x-ray is okay, but it detects too few of the nodules and it detects the disease too late. So CT screening is the best form of early detection we have available today. Hopefully in the future there'll be something else, but today CT screening is the best we have.
Are these types of screenings covered by insurance typically?
Actually, no.
No.
Screening studies are not covered by insurance, and that's one of our big problems. Now at St. Joseph's, we have for the past 5 years been participating in an early detection of lung cancer program. And we offer these screens at a reduced rate. We have screened 500 people and we found 13 cancers. All of those people are still alive. So this is a good thing.
Mm-hmm.
Now if you compare that to say breast cancer, you would have to do about 1,600 screens to find one breast cancer.
You know, when you find the lung nodules, and I've seen lots of scans doing with their hearts, and we pick up a lot of lung nodules also. People have always complained, well, you're picking up abnormalities there that don't mean anything, and so you're doing all these screenings and it leads to another test and another test. But that happens with every test, whether we do a mammogram or, I mean, how do you feel about that? I mean, so you pick up a nodule, that's not a bad thing, it's something that...
Right, at least you know that you have an abnormal growth in your lung. Now what you do about that depends on a discussion with the specialist you go to and somebody who really deals with this on a daily basis. If the nodule is very small, you can elect to just watch it, see what it does, and that's the end of it. If it doesn't grow over the course of 2 years, you have a 99% chance that it's nothing. If, on the other hand, the nodule is larger, let's say you pick up a nodule that's 2 centimeters, well, the statistical probability that that's a cancer is very high, above 85%. Most folks would want to know about that because you want to have that treated. Nobody wants to take an 85% chance that they have a lethal tumor in their body. So screening enables them to have that opportunity.
And just to reiterate, lung cancer is the #1 killer
among cancers, the #1 killer
among cancers
of men and women, which is interesting because most people think it's breast cancer among women.
Exactly.
Not true. It's lung cancer.
It's lung cancer. Yet, are there more people with breast cancer?
There are more people with breast cancer, but their prognosis is better. Now, lung cancer, of all the cancers, has the greatest disparity between early detection and late detection. Our survival rates for early detection lung cancer at St. Joseph's now are 95%. At 1 year.
Good grief.
So in late cancer, it goes down dramatically to about 19%. So you see there's this huge difference. So the whole push in lung cancer is early detection.
Early detection.
Because this is a curable disease with early detection. It's not a treatable disease with late detection. It's curable with early detection.
And the causes. Why don't you explain to us the cause? I know lung smoking is, but how does that fit into the whole spectrum of causes?
Well, the most common cause of lung cancer is still smoking, but what people don't realize is that there are people who never smoked who get lung cancer. Christopher Reeve's wife, for example, is one of those people. So there's a population of people who get lung cancer who never smoked a day in their life. The population we're aiming at right now is folks who were former smokers. Because former smokers tend to think, I'm okay. Well, it turns out you're not okay. And we're detecting cancers in people who have not smoked for 15, 20 years. So the former smokers are a group that we address in our screening program. The current smokers also have risk. And there are folks who choose to smoke. That's one of the things they choose to do, just like folks who choose to eat, folks who choose to drink alcohol, folks who choose to drive without seatbelts. I mean, people make those choices. Those folks who are smokers, if they have an interest in maximizing their odds, the CT screening program is the way to go.
So what are the recommendations now that you give for, I mean, what age for men and women, and should it just be smokers or what else?
I recommend that anyone over 50 who has no symptoms but is a former smoker or a current smoker be screened.
Men or women?
Men or women, men and women. And if you have symptoms, then I would recommend seeing a specialist or going to see your general doctor and getting a recommendation, because not all coughs are cancer. But coughs lasting more than 3 weeks, coughs where you're coughing up blood, coughs associated with shortness of breath or chest pain, see a doctor.
What strides have been made in the treatment? I know at St. Joe's you got a great cancer center now, and there's I know there's a lot of new treatments out there that are improving the survival rate. What is?
Well, you know, that's the whole story.
Yeah.
I mean, that's why I'm here today, because this used to be an untreatable disease. When I went into practice, if you had lung cancer, we tried to keep you comfortable.
Really?
Not anymore. Yeah. Yes, not anymore. Now we have a good shot at curing people. And I have people coming back all the time that are cured of this disease. So that's very, very reassuring. At St. Joseph's, we are a National Cancer Institute designated hospital. And by the way, we're the only one west of Colorado. So there's only 14 community hospitals in the nation with this designation.
That's a great honor.
It's
so
an honor.
It's a place to be.
It's a place to be. It's an honor, and we're doing the latest in research and the latest in therapy. Let me give you an example. You've heard about the Da Vinci robot being used at various hospitals. You've heard about minimally invasive surgery. You've heard about the vaccine for lung cancer. We do all of that at St. Joe's.
Could you please explain for our viewers what the Da Vinci robot is exactly?
The Da Vinci robot is it's a mechanical and computerized device that enables the surgeon to sit in one room and operate in the other room. And you do it with a series of controls on his hands. So, you know, you talk about you want your surgeon to play with the joystick. Well, those kind of surgeons you do. And we have multiple surgeons who use these techniques. Most hospitals only have one. We are very, very fortunate. We have 3 excellent surgeons who have been doing these procedures for over 15 years.
My goodness.
So we're at the cutting edge in terms of our surgical approach, but in addition to that, we're at the cutting edge in terms of our chemotherapy and our other approaches. To give you an example, we're the only community hospital in Orange County that has the vaccine for the lung cancer vaccine trial. And this is a national trial being used on a subset of patients with lung cancer. They have their cancer removed, and then they get randomized to the vaccine group. The results are very promising. What this means is that in the future, people may not have to go through chemotherapy.
That's fantastic. What other things, is there anything else on the horizon that you know of? Like, is there any certain vitamin or supplements or any antibodies or anything else that's in the future there?
Yeah, I wish there was a vitamin. We could all get a little stock in that vitamin.
Vitamin L for
Vitamin
lung,
L,
right?
yeah, for
Yes,
lung, yeah.
exactly.
There was actually a researcher at UCLA who tried to nebulize vitamin E. And the theory was that it's an antioxidant. It would prevent the oxidized breakdown at the lung epithelial surface. Didn't work, unfortunately. But she nebulized vitamin E to a lot of rats and things like that.
Nebulize meaning?
Meaning to aerosolize it, put it in the air.
Put it in the air.
So the theory
Okay.
was that human beings could wake up in the morning, take their puff of vitamin E, and be immunized, so to speak, against air pollution, cancer, those kinds of things. It didn't work out. Life is not that simple.
Yeah. We're just about out of time now, but I think if you had to leave just one thought, is it early detection and no smoking, or?
Well, definitely no smoking.
No smoking.
Right. But I think the thought is this. Lung cancer is now a treatable disease. Go find out with early detection programs if you have it, assuming you're at risk. And then if you do have it, don't give up,
Great.
because there's a lot we can do.
That was very interesting.
Thank you so much for being with us.
Thank you.
Thank you.